Okay, good evening, everyone. On behalf of Group BEAM, I welcome you all to this webinar. Okay, we represent the Group BEAM as such represents the diversity of the Indian culture since we have members from the East, West, Central, North, as well as South India. Before our team begins the presentation, we would like to thank Dr. Sanjay Bedi for this illuminating opportunity. And also here, not to forget our most humble facilitators who have been available day and night for us. Thank you for keeping us energized. The overview of presentation is as such. First, we'll be talking on the assessment of knowledge, which has 4 subheadings, including the long answer question, the short answer question, scenario-based question, and scenario-based MCQ. Next will be skill assessment. Next will be electives, and finally the logbook. Moving on to the first task, that is assessment of knowledge. It is based on the competency 11.3, which states enumerate and describe specific occupational health hazards, their risk factors, and preventive measures. 2 questions have been prepared for this one. The first one states enumerate various occupational health hazards, describe the risk factors associated with the occupational health hazards, and what are the various preventive and control measures for these hazards. The next one is that you are a medical officer at an occupational health center in battery manufacturing industry, and a 38-year-old male person comes to you with complaint of general weakness and loss of appetite since 2 weeks, and also complaining of constipation. On examination, he has pallor, and there is blue line on the teeth gums. The peripheral blood film shows anemia and basophilic stippling RBCs. It has 3 sub-questions. That is, what is your diagnosis of the above patient? What are the diagnostic methods required to confirm the diagnosis? And finally, describe the preventive measures and management of that condition. Moving on to the next part, which is short answer question. We have 2 questions prepared on 2 different competencies. The first competency on which short answer question has been prepared is competency 11.2, which talks about describe the role, benefits, and functioning of employee state insurance scheme. At the end of the session, the student will be able to describe the scope, benefits, and functioning. The questions are, first, describe the scope of ESI scheme and what are the maternity benefits to a woman under the ESI scheme. The next short answer has been prepared on competency 2.2, which states, describe the sociocultural factors, family, its role in health and disease, and demonstrate in a simulated environment the correct assessment of socioeconomic status. The questions are, define the term family and describe various types of families. Moving on to the next one, that is a scenario-based question, and it is based on the competency 12.4, that is describe national program for elderly. And the question is as such, that you are a medical officer posted in a health and wellness center, and an elderly man of age 70 years comes to you in OPD with complaints of severe headache, decreased vision, and slurring of speech. Upon history taking, you realize that the patient is below poverty line and cannot afford any treatment and is homeless. Kindly prepare a management plan for this patient and comment upon the various social security schemes under which you can help him. Moving on to the last part, that is our scenario-based MCQ. It has been prepared on competency 8.1, that is describe and discuss the epidemiological and control measures, including the use of essential lab tests at the primary care level for communicable diseases. The question states that a 2-year-old child was brought by his mother with a complaint of watery diarrhea since today morning. The child weight and height are 11 kgs and 85 centimeters. On examination, the child is irritable and crying, thirsty. The skin pitch retracts immediately. Some moisture is present in the mouth and passing urine normally. What is the child's condition? Next is the task 2 skill assessment. May I please request Dr. Kokila to take over from here? Dr. Kokila, please.
Thank you, Dr. Shelley. Am I audible?
Yes, you're
Yes, you are
audible.
audible, madam.
Audible. Yeah. Good evening, one and all. Thank you for the opportunity given to me. I am honored to thank our facilitators, Dr. Dinesh Kumar sir and Dr. Amir sir, for their wonderful guidance. Both of them helped us a lot for this presentation. I utilize this opportunity to appreciate and congratulate all the facilitators, not only for their knowledge sharing, but mainly for their excellent attitude. Each one of them respect others' view and opinion. Always support each other. I have learned the attitude of hand holding from these young facilitators. I think this is the secret behind the success of this program. Above all, we convey our thanks to Dr. Sanjay Bedi sir for his wonderful initiative. We thank all the colleagues who are participating in the program. Now coming to the assignment, the skill assessment, the assignment given to us is develop an assessment tool based on the assessment method indicated. The assessment tool can either assess any skill objective component of the competency or it can assess the whole competency. Next slide, please. The competency given to us is CM 2.2. Describe the socio-cultural factors, family types, its role in health and disease, and demonstrate in a simulated environment the correct assessment of socio-economical status. And to achieve this competency, we are having 5 SLOs. Among the 5 SLOs, first 4 concerned with the knowledge component. The fifth one is uh, concerned with the skill component. That only we are going to take. Demonstrate in a simulated environment the correct assessment of socio-economical status. The domain is skill, the level is shows how, and of course, core is S, core competency. The assessment tool, what we are going to use is mini clinical evaluation exercise, shortly called mini CEX. It is an attractive format used for formative assessment. Here, the feedback is the core component. The assessment events guide the students' learning. We are assessing the student while they are performing the activity. The student to be taught and aware of what they are supposed to do during the performance or assessment. The assessor uses a checklist to assess the student. Usually in the community medicine, the skills are assessed in most of the institution with the traditional method of clinico-social case examination. In this approach, the student need not require to demonstrate the skills. That is the biggest disadvantage. In many CX, the students we can train and assess to test not only the cognitive but also the psychomotor and affective domain. All the three domains we can train them as well as assess them by using this mini CEX. This can be conducted within a small period of time, some 15 to 20 minutes for a skill practice session. This offers a great opportunity for observation and meaningful and comprehensive feedback by a team of trainers in real time. Because of that, this mini CX, the American Board of Internal Medicine has encouraged its use in conjunction with other student assessment methods. Next slide, please. This is the mini CX format. Already I have shared in the group. Start from the assessor name, student's name, and the patient's name and age. Then what setting we are going to assess them, whether in the urban health center or in the rural health center, using a checklist. So this consists of 5 components, starting from history taking, communication skills, professionalism, and organization and efficiency and overall competence. Here we have to give them the score for the students from 1 to 9. 1 is poor performance, 9 is good performance. If you are not able to comment, we can put as unable to comment also. In the history taking, we are assessing the student whether they are asking the educational status of the head of the family and occupational status of the head of the family and total monthly income. Coming to the communication skill, we are assessing them whether the student is using the clear, understandable language and shows appropriate non-verbal skills during interview and shows appropriate rapport. In professionalism, we are assessing them whether the student addresses the patient by name and responds appropriately to patient's perspectives. And in organization efficiency, we are assessing the student whether he exhibits well-organized approach in scoring the socioeconomical status using the modified Kupusamy scale and calculate the total score correctly. And finally, we can assess the overall competence also. If it is between 1 to 3, below expectation, 4 to 6, around expectation, above 7 and above, it's above expectation. Then there is space for what are the encounters they have done well and suggested areas for improvement and development. Finally, the student can give their reflections also. So the reference was given by Dr. Dinesh during our discussion in the Google Meet 2 weeks ago. This is taken from the developing and pilot testing of a tool for clinico-social case study assessment of community medicine residents by Goel. This has helped us a lot to do this presentation. May I request the participants to observe the role play in which we are going to assess the student using the mini CX who is assessing the socio-economical status of the patient. The role play was recorded in our department. 2 of our postgraduates wanted to do the role play. After getting permission from them only, we are playing the video in the forum. But first of all, I want to apologize for the poor audio quality. Very, very sorry. Yesterday only I realized that no time to re-record that. Now we will watch the video and I will share the mini CX Google form in the WhatsApp group. Kindly rate the student whether he is above expectation or around expectation or below expectation and send it to us.
There is no audio, I think.
No audio, sir. Completely no.
Is it audible to others?
Equal to
No.
me, sir. You know this.
I think it is not audible.
Madam, probably you can explain while video is going on. No problem, madam.
We have
Yes,
also
now the
said that
audio is there. Good. Is it paused?
Yes, sir, now it's. Is it audible now?
No, it is not at all audible.
It is possible. Unfortunately, I am able to hear it. I don't know how come anybody else is not able to. Let me-
What audio is coming? That's all. I have shared it in the WhatsApp also, the link. So participants can listen and view the video there also, and there the Google form link is also there. So it can be done there also.
Amir sir, it is asking for sign in to Microsoft account, OneDrive.
It is directly playing in my mobile. Has anyone tried in the WhatsApp?
Yes, WhatsApp group का audio is much more better. We can hear.
So I think all the participants are requested to watch this video for 2-3 minutes in the WhatsApp group and then fill the form. I think that would be fine.
Meanwhile, should we wait?
Yes, yes, sir.
Okay.
I am putting in the group this instruction.
Participant can watch the video and rate the student.
So started getting responses.
I have sent the video in the WhatsApp group also. You can view directly.
Directly, yes,
If you are
that's
not
very
able.
nice.
Yeah.
So I think, are you able to see the responses, Dr. Kokila?
Yes, sir. 4 responses are there. It's only 4.
Okay, fine. We wait for 1 or 2 minutes more, and then let others also have some feel of an experience of filling this mini CX form at least once.
Yes, sir.
I think we can begin with the presentation.
Yes, sir.
I have shared the findings in the WhatsApp, the screenshot of the findings in the WhatsApp. So you can just tell in the WhatsApp I've shared the screenshot of what we have found.
Yes, sir. There were 19 responses in that about history taking. Majority of them told it's around expectation. 14 of them said it's around expectation. Then regarding the communication skills, 12 of them given that it's around expectation. And regarding professionalism, again 14 said it's above expectation, around expectation. And coming to organization and efficiency, 13 said around expectation. And regarding the overall competence, 11 said over around expectations. Then regarding the which aspect of the encounter were done well, most of them said history taking was done well. Then areas of improvement, majority of them said audio problem and communication skill. Do not read the question like that they have given. Then that's all, sir.
Moving on to task 3, may I please request Dr. Janeta to take over from here?
Yes, thank you, Dr. Shelley. Good evening to one and all. So our next part is on elective, and we have chosen our elective keeping in mind the scope for exploring areas of interest and gaining rich experience in a specific area. So the name of the elective that which we have chosen, it is Community Radio Advocating for Health. So before I describe our elective, I would like to take few minutes in telling about community radio. So Brahmaputra Community Radio Station 90.4 FM, it is popularly known as Radio Brahmaputra. And this is the first grassroots community radio station of Northeast India. And this station was established by the Center for Northeast Studies and Policy Research way back in 2009. So with the support from UNICEF. And this station started its broadcast in the year 2015 under the license of from Ministry of Information and Broadcasting of India. So this is, we thought that this would be a very good platform for our students to work in the area of community outreach experience. So this is why we have chosen community radio as a platform or as an elective, and it would be a good platform for advocating in health. Now, the location of the hospital or the lab or the research facility would be the community radio station in Dibrugarh, that is very near to our medical college. So this is known as Radio Brahmaputra 90.4 FM. And here the internal preceptor would be the faculty from Department of Community Medicine, and the external preceptor would be Mr. Bhaskar Bhuya, who is the coordinator of community radio station. So the learning objectives would be that at the end of the elective, students should be able to enlist the logistical requirements for setting up a community radio. They should be able to engage with the community in a culturally appropriate manner and identify the priority public health issues as a team member of the group. Next slide, please. Next slide, please. Yes. So the third learning objective would be to create community radio programs or a campaign to address one priority public health issue as a team member of the group, and also to obtain feedback from the community. this community outreach experience, working in the community radio station, the students will be exposed to a platform where the station addresses many issues of health along with the other programs, like they have other areas like education, livelihood, but health is also a priority issue in their agenda. So if our students are exposed to this area, then within the coverage of the radio station frequency, the station reaches up to nearly 7.5 lakh of population of two districts, that is Dibrugarh and Dhemaji district in Upper Assam. So this, it includes many tea gardens, more than 200 villages, the island population, that is the riverine areas, and there are many communities in there. So based on population structure and diversified ethnic groups, the community radio broadcast program in different languages and dialects, more than 5 languages. And so this would be a very good platform for the students. And the number of students that can be accommodated in this elective, we have discussed with our external preceptor, and he has given consent that 5 students would be very, they can very well accommodate 5 students. The prerequisites of the elective would be that the student, an enthusiastic, eager, and explorative student, at the same time who's sensitive to work and to the community issues, who will be working, since they will have to work in these riverine areas, and preferably they should know the local language. But or even if they are eager to learn, they can select this elective. Definitely will be taking permission from the authority. And as per the guidelines of the elective from the NMC, we will ensure the safety and the enabling environment for students to learn. But still, we will like to take consent from parents, because they would be working in these island areas, the riverine areas. So definitely, there might be some doubt about it, but we will ensure safety, and they will not work individually. They'll be working in a team. So these are the prerequisites. Next slide, please. The learning resources for the student will be initially, we will introduce them to the handbook on functioning of community radio, and so that they know that in which community they'll be working, though they'll be coming out of their own interest, but there might be a vast difference between the ground realities and their aspirations and the ground realities. So definitely we'll orient them to this. So, so this already available resource which we have about the functioning of community radio would be given to them. And as per the activity undertaken in that particular area, suppose if they are working in, if they have chosen a theme on maternal health or for child health or adolescent health, they will take the requisite government guidelines, and the material will be provided to them. Now, coming to the list of activities in which the students will participate, they will attend the orientation sessions and gain understanding of the activities which are undertaken under the community radio station, for especially for health communication and health advocacy. They would participate in the field visits with the team of Brahmaputra Radio. So here I'm giving the overall list of activities. We will definitely go on to the week-wise different week-wise activities. The next, they will previous slide, please. Previous slide, please. So they will meet with the stakeholders, that is the team of Radio Brahmaputra, the other collaborators, the NGOs working there, and and then going to the community, meeting the community people. They'll prepare the health education material, and they'll be involved in recording, narrowcasting, and broadcasting of activities. Next slide, please. So week-wise breakup of the activities, we assume that in the first week, definitely there'll be the orientation of techniques involved in functioning of the radio center, like the people involved, the other techniques in recording or getting material ready. That will be the first week. They'll be introduced to that part. Second week, the community engagement, that is, they'll be getting involved with the people and know about the particular themes and which they are working on, especially like if it is during the summer time, then the topics for health usually which are taken up, or if it is the nutrition month, the topics which will be taken up. That way they will know about the different themes which they can work about, and then they can choose one particular public health theme from that. In the third week, they will work on the chosen theme, and they will develop the content, get involved in the script writing, recording, and work in that particular stipulated time till they ultimately go on to get the activity done in the community. And in the fourth week, they'll be involved in the broadcasting of the activity and get feedback from the community. So coming to the portfolio entries required, the student will be involved, will write the reflection on the learning experiences, and we want to start it early so that if any uh, uh, corrective measures or if anything we want to do, we can start it early. So reflection on the learning experience would be, they have to do it from the second week and then at the third week. Coming to the next slide. So logbook entries will be as per planned activity, whatever theme they have done and what activities they have planned per week, that way the logbook entry would be done. The assessment will be mainly formative, based on the objectives, whether they are able to describe the components of the community radio, whether they are participating, whether they are able to participate in the particular activity which they are working on, and they are able to plan a theme for the radio program, and they are able to conduct a radio program, both broadcast and narrowcast. So based on the objective and based on the activities, the formative assessment plan will be made ready. So I'm sure this will be a very good platform to offer to the students for an experiential learning in the community setting. And since they have been working, the community radio station has been working from 2009, and from 2015 they have started their broadcast, uh, and also radio is considered a very economical and viable communication medium, and acceptance of community radio as a most participatory communication tool will be very effective. So now I have few photographs of the activities which have already been undertaken by them, where some our departmental people were involved in it. So some photographs of some activities. Uh, Here are some photographs of the activities. And also along with it, we have one or two radio bites.
এই সময় में डॉक्टर के नाई देखाई कोनो दवाई नहीं खाई बुझले हां मां तो ठीक है कहले जा এখন जल्दी से एम्बुलेंस लेके आबी जा हां मैं एकने एम्बुलेंस लेके आता गर्भवती रहा समय में कोनो बीमार होले डॉक्टर के परामर्श के बिना कोनो दवाई नहीं खाबा एटा रेडियो प्रभावित के जनस्तर से प्रसारित
So just now you heard
Radio Brahmaputra 90.4 স্বাস্থ্য শিতানলৈ আপোনালোকক স্বাগতম জনাইছো Radio Brahmaputra 90.4 FM or স্বাস্থ্য শিতানলৈ আপোনালোকক স্বাগতম জনাইছো Radio Brahmaputra 90.4 FM or স্বাস্থ্য শিতানলৈ আপোনালোকক স্বাগতম
Okay, Dr. Shelley, you can pause the audio. You can pause the audio. So that was one radio bite from one was enacted by the team of Promoter Radio, and one was from a medical student who was very eager to help us when we were planning for the selective, and she had given that bite about introduction about the program, and another one was from the team. So next, we are very thankful to the coordinator of Brahmaputra Radio who very eagerly said that he'll be able to help us out and give an experience to our students. So he has just now sent a message to us. So I would like to run the message sent by the coordinator from Brahmaputra Radio, Mr. Bhaskar Bhuya. Please, Dr. Shelley.
Shall I play, ma'am? Okay.
Yes, sure.
Good evening, the organizer and the whole team of competency based on medical education. Myself, Bhaskar Bhuya from Brahmaputra Community Radio Station, and we are based in Dibrugarh, Assam, and working with the most vulnerable communities of our region from last one decade. Especially, we are very thankful to all organizers for giving us the opportunity and taking up the community radio initiative in the field of health communication. It will be a good platform for medical students to explore various community health matters in the sense of health communication through participatory approach, and it will definitely help the medical students to get better understanding on community health issues. And I shall extend my full support for this endeavor, and thank you all again.
Thank you, Dr. Shelley. So that was the message from Mr. Bhaskar from Brahmaputra Radio. Now, strength of the elective is that this would be an area for developing creative ideas of the students. Then they will be able to improve their communication skill. At the same time, they'll be able to work in different areas of health, maybe maternal health, child health, adolescent health, pediatric health. And this elective can be continued for the coming batches of students, because in 1 month we would be able to work on only one particular area. So they would be continuing with the other topics, and the next batches of students can go on. They'll be able to understand the ground realities. And another very important point is that it is available in the vicinity of the medical college. The students will have the opportunity to work in a diverse environment and be a part of the community, and at times, and they'll be able to develop and transmit the health messages to the community. They'll also be able to see the ground scenarios and gain experience outside the traditional boundaries. And this will be an elective based on local circumstances and perceived need. So thank you all. Now I would like to call upon our next presenter, Dr. Ipsa, for the part on logbook.
Good evening, one and all. We'll start with the last part of today's presentation, that is logbook. Ma'am, please can you change the slide? So what we have actually done is we have identified a core competency which is vertically integrated with pediatrics. So the core competency comes under PE 9.6, and here the student was required to be assess and classify nutritional status of infants, children and adolescents and recognize deviation. It was, the domain was skill, level was Shoha. It is a core competency, and the suggested teaching learning method was bedside clinic or small group discussion. This is what which is given in the MCI document. As we have a posting for school health visit in our clinical posting schedule, and it was not an identified core competency in community medicine, but towards the end we have it in the vertical integration part in pediatrics. So what we have done is we have tried to put it in the logbook section so that we have a identified core competency wherein we can have a visit to school done for the students. Next slide please. So the activity will be visit to school. The competency will be under PE 9.6, and the specific learning objective for this competency will be to screen school children for early detection and correction of health problems. So this is a template wherein we have the competency addressed as vertical integration with pediatrics under PE 9.6. The activity is visit to school. It will be done on the mentioned dates, and as it will be an attempt, first attempt for the child, then we'll be rating the students whether they meet our expectation, whether it will be below expectation or exceeding our expectations. Then remedial measures will be taken if there will be needed a repeat or this thing. Then we have the initials of the preceptor who will be accompanying them, and every student will be given a feedback. Ma'am, next slide, please. So coming to the components of the activity, we'll be having it under various headings like the prerequisites, the criteria for successful completion, and the assignment section. So what we have is, the first part is the prerequisite. So for the prerequisites, the students by then should have a prior knowledge on how health and education sectors can work for health promotion of the school child. They need to identify the range of needs of the school children for optimal development so that the school children can be empowered and act as agents to improve health within the family and community. Ma'am, next slide, please. For the criteria for successful completion, at the end of this session, the student should be able to describe the objectives of the school health program, the role of the school authorities, including the principal, class teacher, parents, and volunteers in planning and implementation of the school health program, the role of the public health inspector in school sanitary survey, the health promoting school concept, that is the establishment of school health clubs, implementing healthy canteen and eating policies, adolescent health monitoring and lifestyle programs, the micronutrients which are given to school children with the frequency, dosage, and how it is monitored and distributed, then the school dental services and records used in school health program. Coming to the assignment which will be given, ma'am, next slide please. The students will be required to participate in the health screening school visit, examine children, and learn the skills of filling the school health record and write an appropriate referral. They need to conduct health checkup of the school children. At the end of the 6 days posting, they need to do a data analysis and presentations of the findings after the school visit. They need to document the health education activities which are taken in the school, and this field widget should be written in the logbook. Ma'am, next slide, please. So we have made a checklist wherein we have identified that school medical inspection to be undertaken by the students will be basically under 3 categories. In stage 1, will be the first stage of screening will be done by the public health inspector, wherein he'll be assessing the nutritional status and health problems, treating the vitamin deficiencies and parasitic infestations identified, and these children who have learning and behavioral problems will be screened by the teachers. The stage 2 is where the students will come, and under the supervision of the medical officer, they will be needing to conduct the weight and health, height measuring and recording, the vision testing using the visual acuity within Snellen charts, and learn to check and record the hearing defects. After this, ma'am, next slide please. There'll be a follow-up of activities wherein the children can ask, like the students can ask the public health inspector on how the children who were identified with defects have been followed up in the previous months. So usually the school health programs, they have a quarterly health checkup which is conducted on a regular basis. So these documents can be seen by the students and followed up so that the children who need special care and attention are identified and these cases are studied. Next slide, please. Other than these checklists, what the students can do is they can take up health promotion activities wherein the students are made aware about their safety, about physical activity programs, school midday meal programs, then about the hygiene they need to maintain, then about the other activities like school health clubs. The students need to make an observation of the entries of these health records and how these records are filled so that they have a broad overview of what is being done through the school health program. So that is all about the school health visit plan for the students. Thank you.
Thank you, everyone. So now the house is open for question answers. There are some questions in the one question was in electives, how do you plan to collect the feedback from the community? So I have mentioned here by some house to house survey in the last week, some method has to be adopted. If the group wants to add something, then they can add that in this
Yes.
elective. How can the feedback? Yes, ma'am.
Okay. So thank you, sir. Um, Actually, though we have not started with our undergraduate students as of now, but this with the community radio center, uh, faculties are already involved in some activities. So when some program are being done, when we select the theme, and it is like it is decided beforehand that in which community or what is their problem and in which community will be paying those aspects. Suppose for in the tea garden community, anemia is a major issue there, and we have prepared the skit on there. So we do the recording, and then we are going back and playing the radio in that particular community where they are informed beforehand. So definitely there is a one-to-one communication, and definitely when they are told beforehand that we can gather themselves, and then these recordings are taken in the mobile. The team members, the team leader with their group, they go on specific date, and then they collect the messages from the community. And community also, as of now, down the decade we have been working, so they used to send the messages, the recorded voice messages they used to send to the center in the mobile or the WhatsApp. So we can adapt any one of this method, either asking them to send the messages, or they can join in a program where they can submit their feedback. I hope I answered the question. Thank you.
Thank you, Dr. Janita. Another question is also for you only, that who are the main, by Venom Bodhi Shri Vidya ma'am, who are the main stakeholders of organization 90.4 FM and how it was connected to medical college, how this was initiated and by whom. So she wants to have some idea about how this linkage got initiated, I think.
Okay. So, like, I think Mr. Bhaskar Bhuya would be the right person to say about that. But I can just give a little bit of idea that the station was established by Center for Northeast Studies and Policy Research. So this is a group who you might be knowing that they have started the concept of boat clinic in Assam. The AHA boat clinic, that is into the riverine areas, they provide health facility. So that group of as is an NGO, Center for Northeast Studies and Policy Research, they had got a World Bank fund. With that fund, they had started the boat clinics in Assam, and along with it, this radio center, Radio Brahmaputra or community radio. This is a linkage of community radio across India. So it was supported initially by UNICEF, and then it has started, and then they went on to the other processes of getting the license, working in different areas. So I can say only this much. Like I can link up with Mr. Bhaskar to give you a elaborate plan, like elaborate way how they established. But when because they were not from medical field, they were in diverse areas of communication. But when they had started the health topics, they used to link up with the medical college because it is so near to us that it is just 3 kilometers from the medical college where their center is. So they used to call health experts to give health information to the people. Also, they used to gather community members in their station itself, the pregnant women or under 5 child, where pediatricians, gynecologists, and community medicine persons used to go and deliver the services. So that way, slowly, the collaboration started.
Thank you. So I think many activities, colleges are involved and many organizations are working with the colleges till now, but it was not formalized. Electives and these things give an opportunity now to the medical colleges to make these linkages official, and so that more people can go into new areas of collaboration and give the student a more enriching experience during their medical course. So I think
Yes.
I have unmuted Dr. Nishant Krishna. Dr. Nishant, it was your question. So if you have anything to ask, you can ask. I have unmuted you from my side.
No, sir. The question was answered, sir.
Okay, okay, Dr. Nishant. So, okay, then you can mute yourself. And Dr. Shri Vidya, I have, ma'am, I have unmuted you also. If you can unmute yourself and give your comment, please. Dr. Shri Vidya Bodhi, ma'am. So I think there is some issue with the connection. So any other question? Yes,
Amir, Pankaj,
yes, please.
I just want to ask a question and all of us rethink. This is a very good elective as far as the community radio is concerned. It will be excellent experience for all undergraduate students, and they really will understand what is the community radio and how the things can happen at that area. One, there will be a logistic issues. There are places where it may or may not be feasible, and how things will move. But I have a larger question, or rather, thing which I will need a diverse opinion from all of you. Will it fill in the era of elective? Because when we see the GMER regulation and other things, it talks about career opportunity, it talks about some kind of a curriculum enrichment projects and something. So I'm really not able to make out, to be very honestly, that will it fit or it will not fit. So I'll be happy if everybody gives a diverse opinion on that. uh, uh, is it an excellent thing, but I don't know can be called as elective. I'll be very happy this can be taught to all my undergraduate students irrespective of elective, because when I say elective, it will be only those 5 people will get a chance and not all 250 or 150. So I'll be happy if everybody gets a chance. But if suppose that is not possible because of whatever reason, will it fit in the criteria of elective? Because tomorrow my elective should not get rejected, then it will have their own repercussion with respect to university examination, completion, attendance, and so many things. I'll be happy if people give their own opinion so that I will build up my own opinion on that.
What is your thought about this? What do you think?
So to be very honest, Amir, I am not sure. That's why I thought, will it fit? Will not fit? I don't know.
So you
To be
you
very
don't. Okay,
honest.
fine. Thank you, Dr. Pankaj, for that comment. First, I would like to invite our group, to respond whether they think it is an elective or not, and then we will take the opinion of others. So anybody from our group? So any of the faculty, what is your opinion? It's a good point of discussion.
So this is Dr. Himangini here.
Yes, Dr. Himangini, please.
Just with reference to, I had taken a session, webinar on electives, and that time we had a lot of questions related to these aspects. I would say this is definitely an elective, and if there's no such thing as an elective can get rejected, I feel. If there is a very well designed program which is scientifically sound, and it is serving the purpose of achieving the objective, it is definitely an elective. It can be pursued further. Not only this, we could have areas like a different form of art, where there were people who were interested in dance therapy, musical therapy. So these are not the standard ones which we feel are supposed to be elective. They are a little more on the periphery, but if designed and structured well, they can definitely fit into a very good elective. And there are many of these students maybe have joined medicine, but have an inclination to art. So they tend to, benefit from these kind of electives. Even videography. So, but it should definitely have a medical connect to it. So that way, when it is structured, it goes through as an elective. This is what I perceive. Thank you, sir.
Thank you, Dr. Himangini. Any other faculty? It's a very important point, and I think the faculty will share their opinions also.
Can I?
Yes, Dr. Parag, please.
Thank you, Pankaj sir, for bringing out that important point of discussion. I agree with Himangini madam. The other day I was talking with someone that these humanities aspects, we thought that we cannot build electives around them. And then later we thought that for, let's say, for under National Health Mission also, for our behavior change communication strategies, we need people who are dedicated to this particular aspect. And then fortunately with increased funding, now there are separate posts and positions also within NHM where we need people with this spatial skills of communication and better at humanities and these certain skills. So that way it fits into this also. And if not anything else, this particularly is probably an elective which gives the students an elective at entrepreneurship. I mean, this would be something which would eh, show the path of entrepreneurship to the student also. And Himagini Madam has rightly touched that there are certain fields where the students might be interested in those aspects of humanities, and who knows that they might do a career in them as well. I see that there is a possible scope. Thank you.
Dr. Parag. Any other comment from any other faculty? Dr. Manjunath, sir? Dr. Somdatta?
Yeah. So I actually what I found that how the team has structured also the elective, that was also very nice. I found that they said that they have to do actually in a aspect which is going to be a public health problem. So I thought that this is also giving the students an excellent opportunity to understand also, or like to select uh, what is uh, what is a public health problem, and to choose which is relevant in their context for which they can work into. So like Dr. Himangini and Dr. Parag brought some aspects into it, but I found like as such also like this is aligning very well with the community medicine thought process. So I think I am okay with this type of electives. That's all from me for this point.
So what Dr. Pankaj sir mentioned also has a point. We have to have that caution. We shouldn't get carried away with things and do it just like, it shouldn't be just an entertainment kind of a form which is there. But as long as everything is well structured and it is achieving the objectives that are to be met, electives can be in various areas of interest. Definitely. It could be, varied interest in humanities, and students are really interested and they can do a great job. There is a section always of students, if you see, even in the various extracurricular events, they'll be very active with certain kind of, performances. So these things can be taken up, but definitely what Pankaj sir mentioned is we have to see that we don't get carried away and it just becomes like an entertainment. It has to have its scientific basis. Thank you, sir.
Thank you, Dr. Somdatta and Dr. Himangini. Yes.
Amir sir, there is also a little comment on the WhatsApp participants WhatsApp group. If you wish to bring in that.
Yes. Yes. So Dr. Manoj Patki has written that it has larger perspective and under a national NRHM and structured way to learn more. Community radio will fit as elective as it is local need in Northeast. This is there more than one decade and has got lot of national attention under NRHM as best practice in public health. And then Dr. Vidya Bodhi has written, I think based on the local context, available resources, this type of elective can be planned. And Dr. Ankita has mentioned not all may be interested in radio, but there are many other opportunities based on the interest and feasibility of the same through the colleges. So I think right now we have a certain opinion building up. I would just like to conclude this from my side. One is that if it does not confuse you that whether it should be there or it should not be there, if it convinces you, if you are very convinced with a topic, it means that you are used to that topic. I have a rule of thumb to decide certain things, that if there is some topic and I feel it is very much, I am very much comfortable with it, then it is actually, I am used to it and it is a traditional curriculum. Because the moment something new will come, it will disturb me, it will shake my conscience, it will shake my thoughts, it will shake my belief, and then it means that something new is coming to me. So I think that this particular thing, as Dr. Pankaj has rightly pointed out, and when it came to us in our group discussion, we also at first started thinking that whether we should say or, but then that innovation, that innovativeness, and that intersectoral collaboration, that moving beyond the boundaries, and elective as a window to newer opportunities, because the medical curriculum is actually very closed curriculum. So that is only 1 or 2 months of elective that is there, that gives a window of opportunity to look into work with other groups and other specialties. For example, I would say big data, artificial intelligence, engineering, dance, theater. There are so many things that are there that medical professionals can come join hands with, and this elective can be there. So I think Dr. Pankaj sir's comment is valid at this point, that yes, it should have a very clear cut defined public health perspective, and there should be a clear cut benefit to the field of public health through that elective, but and we should not get carried away as mentioned by other faculty. So I think with that, that is all from my side. So Dr. Pankaj, last comment from you on this discussion, please.
Sorry, again you have brought the issue back to me. I thought, but listening all the thing, to be very honest, I still carry the same opinion that I am not sure. Though I do not disagree that it is not important. It is very, very important. It is very good to be taught and the learned by the student. I'll be happy if it can be implemented to all the students of 250 rather than selective those five people. That's my still opinion, but I am not going into a debate of elective or not elective because I am still not sure. I'll go
So
with the majority opinion, but
okay,
I have
Dr.
not built up
Pankaj.
my opinion.
Yes, that is very nice. So, Dr. Pankaj, I have a request. Uh, let us go
Yes,
with
sir.
something that
Yes,
we don't think it will work. Let us
yes,
go
sir.
with
I agree with
something
you.
new.
Yes, I agree with
Let us go with something new and allow some new ideas to develop. It might work, it might not work, it might be accepted, it might not be accepted, but just there is 1 month of electives where we can use our free mind.
you. Yes, agreed. Yes, agreed.
Thank you. Thank you so much. Okay, so I think so that was a good discussion. And any other comment from any other faculty, any other participant?
Participant?
Amir, if there is no question, I want to go back to that scenario where the dehydration was one of the question with four options.
Yes, Dr. Shalli, please. Can we go to that slide,
Yes, sir.
which Dr. Pankaj is
Yes, sir.
referring
I'm
to?
just.
I am not talking into the technical detail about the content and the option. Just looking as a lay person, my personal perception. Again, I am repeating as a lay person. The option D is slightly different from ABC.
Yes, Dr. Shalli can respond to the query, I think.
Sir, Vishweshwara, sir.
Or Dr. Vishweshwara, yes, you have. Okay, made this. Please go ahead.
Sir, some deviation I made an option, sir. I have dehydration option also, but to deviate, so MCQs means it's to assess large group. Some deviation from the main topic, I have give this option, sir, pneumonia.
So would you like to reconsider, or do you think that it is okay after the query has come in?
I think it is okay, sir.
I'll again specify my thing more again as a lay person, not a technical person to judge the question and answer. If suppose my option D, which is correct, okay, and I
Yes.
assume that other as a just a vague student, as a funny student, if I know A, B, C, which are similar, are not going to fit, then I am giving a student option of D, which is 100%. Only one option effective as such. If I am believing that the dehydration thing is going to be correct as again a funny student, not well-read student, then I get only three options in my mind is only 33.3%. Then the fourth option has no value. So I'm looking at is all four options really serve the purpose of being as an option for actual answer or distraction.
Okay, sir. Understand, sir. Okay, sir. Oh.
Can I?
Yes, please.
Yes, so I guess Pankaj sir has made a nice point. Let's say if I were to improvise this, I might write fourth option as say total dehydration. We know that there is no such term, but probably that still would serve as a better distractor rather than pneumonia.
Right. So yes, so MCQs, the distractors should be chosen very carefully, and Dr. Pankaj, I appreciate his very keen observation. So I think it's a point well made and point well taken.
Say something, sir.
Yes.
But I also feel that since we are talking about an under 5 child here with the most common problems, two common problems which are faced are pneumonia and your dehydration, as we see that diarrhea and pneumonia, and we consider them as the major diseases in under 5. So I don't think there's an issue if this option is like if pneumonia has been given as an option. Child can be although we know that most of the points here like being thirsty or skin pinch and all more or less are pointing towards dehydration, but the child is also irritable and crying, so I don't think there's an issue with that. Plus in most of the MCQs, like we also see usually there are two options which are quite confusing and two are directly seen that they are wrong only. So I don't know if there is an issue with that. I totally agree with Pankaj sir that he has pointed out something well, but I don't find anything wrong here. Just a personal point.
Fine. I think that is where the importance of, thank you for that comment. The importance of looking at the MCQ questions and doing the various things, the various discrimination index and the other things that are there. So it is important that then we get an objective answer. Right now, what we are dwelling with is in subjectivity and what we think, and there might be different ways of thinking about a certain context. So when we have those objective criteria, and if we use it in some formative assessment, maybe on our small batch, this particular questionnaire, and then we find which distractor is playing well, which distractor is not playing well. So then we will be able to point this out. So this issue will be there in MCQs. So I would just say that it is a good practice to before we go for using some MCQ in a summative assessment or in a internal assessment, it is better if we can use some MCQs beforehand and see some of the objective indices that are there to test the quality of MCQs. Then that way this question can be answered in with evidence and with the that can convince everybody, I think. Any
Right,
other
sir.
comment
Thank you
on
for your
this?
comment.
Thank you very much. Yes.
Thank you, sir. Thank you, sir.
Amit sir.
Yes, Parag, please.
Thank you, Shali madam, for sharing that. Probably just to explain what Pankaj sir was meaning was that pneumonia, looking at the description and looking at the common diseases in that age group, we understand that pneumonia is still a possibility. In that way, it's logical. But what Pankaj sir was referring to was that even if the student has not read, that's why he insisted that as a layperson, he would be able to eliminate this particular option. So it means that a test-wise student will be able to say that this surely would not be the correct answer. So that's what we are discussing, not necessarily the technical aspects of it.
Right, sir. Right.
So that way it becomes a defunct
No, sir. Point noted.
option.
Right, sir.
Yes,
Point noted.
absolutely. Because that fourth option is a student would really definitely know that that is not the answer. So it's not a good distractor.
With that, let me also add that once we start framing MCQs, finding the fourth option or the third distractor is the most difficult task. Whenever we try doing that, we understand that this is a challenging task. So that's also true alongside. Thank you.
Yes, Dr. Parag and Dr. Himangani, you are right. And Dr. Somdatta wanted to say something.
Yeah, so I wanted to ask the team about the elective only, what they have shown. So I wanted to know, like, as most of us found that it's a very interesting elective, I wanted to know what is the mechanism in place to supervise and monitor the students, whatever they are developing, before you go for broadcasting. Like, because as you are running it, you must have developed something by now.
Dr. Janita, is it possible to respond to this for you? Yes, please.
Yeah. Ma'am, did you ask about like what is the mechanism, how we will monitor or supervise the students?
Yeah, basically
Hello,
because yes, Dr. Janika, because I can see like the students are doing this, right? Like students
So
will be
presently
developing the
students,
program, students will be using it. So how, like, the teachers are supervising and monitoring the whole program, and like before broadcasting, what are the steps you are taking?
yes, ma'am. Actually, now students are not involved. Now only faculty and some other, like from mass communication, some students are involved. Our students, like only those interested, once in a blue moon they used to go. But since it is not officially, we are not doing it. So, like the plan which we have with us is that they already have their teams in Brahmaputra Radio. The group, there are community volunteers, there are their own staff who are working. So minimum 5 to 6 teams are there. So out of the, in those teams there are one team leader and who used to plan that particular activity. Suppose for example, for Poshan month they will work on one particular theme on nutrition of under five trial, and especially they are taking suppose one group 6 months to 1 year group. So there they used to take the government guidelines from there, the translated versions they used to work on, and then they used to talk with the community, know what the community is doing, what feeding practices they are doing, and what is as per guideline. And then that team used to work in one particular areas, and then they prepare the script, they record it, and the narrowcasting part they used to narrowcast in that particular community from where they had taken that particular messages. And then so it becomes the one-to-one communication. So that whole group of 5 members who are working in that particular area, suppose in one uh, riverine area, suppose the population is about 1200. So there in that meeting the female members used to come along with their children, and also the husbands are invited, and then they will listen to the government guidelines and they will see their own practices. So these workers who were working in that particular area, they come to know, they come to know that what the community said and what is as per the guidelines. And then next next week when they again go, or if it is another month they are working, then they see the improvement, that what they had heard from the narrow casted part and what they are practicing, whether there is any difference. So now, as of now, it is going on like that. And again, they used to give some competitions, some cooking competitions are there. So then they will correct those practices, that yes, this is the way this you can give you. And they prepared one guideline, they prepared in local language, they prepared a feeding guideline for these people based on the government guidelines. So I think that way, the team, the whole team, when they are working, they will be giving feedback and also supporting. Hello, ma'am.
Thank you, Janita. I think Dr.
Yes.
Somdatta has brought out a very important point, and I must admit that we did not because the MBBS students till now they are working just on their own volition. It was not a structured program till now, but maybe with coming of electives it can become. Definitely, this monitoring part will have to be there. One thing that we just put it here for that part, whether it suffices or not, it is difficult for me to say. But if you look at the learning objective, we had this engage with the community in a this appropriate manner, culturally appropriate manner, identify public health issues as a team member of the group. So they are not completely independent. This team member, when we mention team member, it's not only a team of medical students, it's a team of even the mass communication students, the people from the that technical team of the radio Brahmaputra. So it's a team, it's a collaborative team in the real sense. And as a team member, so there will be checks and balances from the other team members also, and the people who are involved actually in the community radio from the beginning. So that we thought will be serving as an internal monitoring, supervision, and this thing. But definitely, yes, we should have a structured way to monitor from the medical college
Yes.
faculty. That needs to be developed.
Yes, yes, that we have to develop more. Yes.
Does that answer your query, Dr. Somdatta?
Definitely. Thanks.
Thanks a lot.
Thank you, ma'am.
So,
Thank you, ma'am.
so I think one comment is there in the group by Dr. Prasad. Dr. Prasad Pure sir has mentioned, instead of elective, this can be added as a part of posting in UHTC so that all will get exposed to this kind of experience. So for this, I would just like to say that yes, any activity task can be added for during posting in a regular way. The only thing will be that the related competencies which is there in the our curriculum document, we have to address that, and with that addressed, I think this can be taken as a regular part of the posting, as Dr. Pankaj was also referring to. So I think yes, that can be done. But if you need to go into some other arena also, then you can take it as an elective, because it might happen that all might not be interested in it. So that is a case to case on basis. Some activity may be there in some college as a regular feature for some competencies, and in some places it may be as a giving more hands-on experience working with in the real life settings. For example, here for 1 month it is like the student is completely working with those people, radio people. So but in the posting it will be like for 1 day, 2 day, 3 day, or so for some days it will be there, because I don't think we can devote one full week or 2 weeks to community radio in a regular UHTC posting. That might not work that way. So for a enriching experience where the student, as Dr. um Parag says, that entrepreneurship skills also can be gathered. For that purpose, we need to give them a full exposure kind of thing, real world setting exposure. So for that, if we want, then we can use it as an elective. Otherwise, for taking up completing certain competencies, let us do it in a regular way in our day-to-day activity as a UHTC posting. That's right. So I think lots of discussion. So any other comment? I think we are 7:33 right now. So any comment from the other faculty members? Dr. Animesh is here. I see Dr. Manjunath sir. Okay, so I think we can end this webinar now. So thank you all for joining.
Thank you, sir. Thank you, all of you.
Thank you very much. Thanks to the presenters and very good efforts by the whole team. It was really a big teamwork. So Dr. Itsa, especially Dr. Kokila and Dr. Janita and Dr. Shelly and Dr. Vishweshwara and others also, whom I am not able to take the names, but they all contributed. So just two take-home messages, I think. Electives should be in sync with the public health perspectives. And regarding question framing, I think we need to share it with our peers, take some feedback for subjective assessment so that we can be more sure of what we are asking about the distractors. And if possible, we can do some objective assessment also of the quality of questions. So I think with that, we come to an end to today's presentation. All the best to the next presenter, next presenting group. Thank you, everyone.
Thank you, sir.